Hello and welcome to Lung Cancer Connect. I'm Lorraine Dallas, the Director of Information, Prevention and Support with Roycastle Lung Cancer Foundation.
Thank you, Lorraine. Good afternoon to you and everyone. My name is David Gilligan. I'm a consultant clinical oncologist specialising in lung cancer, and I'm based in Cambridge.
One question to start around thinking about lung cancer diagnosis. What are the most common ways that people find out that they have lung cancer?
Lung cancer is diagnosed in many different ways because it can show itself up or present in many different ways. Probably the most common is with chest type symptoms of cough, coughing up blood, shortness of breath. In first instance, we'd go to the GP, either a face-to-face appointment or in the current COVID times via telephone or a video appointment. However, other lung cancer can be picked up in other ways. One important way and very significant way is if it's picked up incidentally. If someone's having tests for something else, like a chest x-ray before an operation, and it shows up something on there, and that can pick up lung cancer, and that can be at an earlier stage.
And in terms of some of the information that we see covered sometimes in the news, can you tell us, is it possible to have a blood test that identifies that you might have lung cancer?
Well, that's a really interesting question. I think at the current time, the answer is no. There aren't any blood tests that will say that you've got lung cancer, although people are working on that, and there are trials and research going on in the UK and other places to see if we can actually work out can this be lung cancer on a blood test. At the moment, no, most definitely not, but that might be the case at some point in the future.
And what are the usual tests and investigations that are carried out to find out if someone has got lung cancer?
So the tests that are normally done to diagnose lung cancer include X-rays or scans. A chest X-ray is probably the most simplest and easily available of those. But normally that would lead on to a CT scan, which looks in sort of 3 dimensions at the body, the chest and the abdomen, to see if there is a cancer there. And if a cancer is suspected, then normally there are other tests to show how far or not that it's spread, and also to try and get a piece of the tumour so that we can work out, first of all, is this definitely lung cancer? And then secondly, does this respond to a particular type of treatment, and what's the best treatment for that type of cancer? And so biopsies will need to be done usually. Now, they can be done in various ways, sometimes through bronchoscopy or something called endobronchial ultrasound, EBUS. That's taking a small piece of the tissue from the lung, or a biopsy on the CT scanner. So there are a number of ways in which lung cancer can be diagnosed, and there are many different tests. And if you are being investigated for lung cancer, the team looking after you will discuss all of the different tests that are needed in order to diagnose that.
What does that mean in terms of the time it might take from somebody perhaps being at the hospital with a concern they might have lung cancer to arranging treatment? How long might that take?
There are guidelines and standards to set so that tests to make a diagnosis should be done within a few weeks, and the diagnosis should be made within at least 60 days or 2 months. But that's hopefully the extreme, and in most cases, people who are referred for tests who are suspected of having lung cancer hopefully will be diagnosed with lung cancer or given a diagnosis of something else if it's not lung cancer within usually a few weeks, and then treatment usually starts pretty soon after that.
What kind of symptoms should people look for if they are concerned that they might have lung cancer?
If you're concerned that you might have lung cancer, there are a number of things that you could look out for. I think you can split them into two broad groups. One is what might be obvious, which is the sort of chest-related problems with your lungs. So a cough, coughing up blood, just a change in your cough that if you have a chronic cough that is different, or breathlessness or pain in your chest, which doesn't feel right and doesn't go away. But you might be feeling just generally unwell. You might have lost weight. You might have pains in other places, or just be feeling very ill in a non-specific way. And if that's the case, then again, you need to see your GP, who will organise some tests which may point to lung cancer. Equally, they may point to something else, but it's important that if you have these very non-specific symptoms, not feeling just quite right, those are checked out.